Welcome everyone. This is the second lecture of the course. In the first lecture, we basically saw the history around which Freud was working. How Freud went to university, was kind of dissatisfied with how he met anti-Semitism there. He went from trying to study law to study medicine and physiology. He went to Brucker's lab of physiology, and he went to Charcot in France. What did he see in France? What was the situation in France? And all those things that we saw last time. So today, what we will do is we will focus on a part of Freud's time from 1885 to early 1890s. And we will look at partly what Freud was doing with Charcot in France, but also we will look at what Freud published after that under specific topics. So specifically, we will be looking at the pre-psychoanalysis period, and the topics will be hypnosis. So Freud did a bunch of stuff on hypnosis under the shadow of Hippolyte Bernheim. We will see who that is. We will look at some early approaches to hysteria through hypnosis. A bit of that. We would go into hysteria very deeply in the coming 4 lectures, just on hysteria. And then we will look at, lastly, on aphasia. And aphasia is the first official monograph book published by Freud in 1891. So that's what we will be doing today. So between... Oh, you're not able to hear? Is my voice coming?
Yes.
Okay. I just got a message. Daedalus, you might have to reconnect. Okay, so hopefully I'm coming for others. Okay, going back. Between 1877 to 1900, Freud had written and published about 100 neuroscientific papers. Most of them have been untranslated, and it's usually considered by psychoanalysts that much of his early work on neurology and neuroscience doesn't really have much to do after he stumbled upon psychoanalysis. And this is partly because of Freud himself. For example, one of the controversial papers from Freud is Freud's project for scientific psychology, something he discarded himself later on. But it was supposed to be psychology for neurologists of his time. And so Freud's relationship to neurology is kind of very ambivalent. And it has affected how post-Freudians and psychoanalysts who came after Freud to consider his works. Not a lot of people take the neuroscientific works very seriously, apart from a much recent group of psychoanalysts and neuropsychologists who have been interested in the intersections. For example, that will be the school of neuropsychoanalysis, founded by Mark Solms and his colleagues. And so Mark Solms, just as a side note, has been translating much of these untranslated neuroscientific works of Freud. He translated 2 of these dictionary entries that Freud did, and he published them in 1990. There's an entry on aphasia and an entry on the brain anatomy. I will not go into the brain anatomy paper because it is very technical and doesn't really have much to do with what we're doing. But if people are interested in looking at the intersections of what Freud did early the neuroscience, they should look into those two papers. At least those are the ones that we have access to. So yeah, so it's very difficult to read the neuroscientific papers and try to connect them to psychoanalysis per se. But again, I'm referring to those who are interested in the history of neuroscience, and neuroscience itself could go into that more. So Freud spent 6 months with Charcot and his students in France at the Salpêtre. And it was around 1886 that a professor from Nancy was starting to formulate critiques of Charcot. So Charcot, as I said last time, used to be a superstar of his time, was a celebrity in his profession. But around the time of 1886, 1885, there was a man from Nancy who was starting to heavily criticize Charcot's works on hysteria. So this was also around the time that Freud was kind of getting himself over Charcot, because Freud was very much amazed by Charcot's work, attending his Tuesday lectures, the stage demonstrations of hysterics had amazed him, as he would write in his letters. But after he saw Bernheim's critiques, he was much less inclined to blindly believe in Charcot's works. So so the man from Nancy, the doctor from Nancy who was critiquing Charcot, was Hippolyte Bernheim. So Bernheim, by the time, around 1886, had no interest in nervous diseases. He was much rather interested in neuroanatomy. But due to the work of another person named Ambroise Auguste Libaud, he was starting to get interested into this thing called hypnosis. So Charcot had already been trying hypnosis on his hysteric patients. But Bernheim was following Ambroise, who had this idea, which was very much unrecognized during that time, but now it's almost considered normal. And the idea was that the states of hypnosis were various forms of sleep that are induced through suggestion. It is not uncommon today to think of hypnosis as just a sleepy state in which you put suggestions into the mind of the patient or the subconscious of the patient. But it was the discovery of Ambroise during his time, which was quite disregarded in the scientific field. It was quite well regarded in other fields like animal magnetism and other quasi-scientific areas. But Bernheim followed Ambroise quite, line by line. So Bernheim's On Suggestion and Its Therapeutic Applications was one of the very first books on hypnosis with a strictly psychological approach. So it was Bernheim was the man who wanted to bring hypnosis out of this mystical kind of domain into doing actual scientific work with it. And again, as I said, even though Charcot had extensively studied the hysterics under hypnosis, what he was working under the shadow of was the belief that most of what the hysterics were presenting were neural dysfunctions. So Charcot had the idea that hysterics and the symptoms that he was able to show or predict were totally neural dysfunctions. There were things that were going wrong at the neural level, and even hypnosis was just altered states of consciousness that were coming out of these neural dysfunctions. Nothing more, nothing less. Because, of course, as we have seen before, Charcot was quite a positivist following Auguste Comte. Right? But Hippolyte Bernheim was not really a fan of this, Bernheim considered that it is wrong to believe that the subjects influenced through hypnosis are all weak-nerved, weak-brained, hysterical, or women. He said most of his observations relate to men whom I have chosen on purpose to controvert this belief. So he said that even though, like most of Charcot's patients were considered hysteric and weak-nerved, weak-brained, or something of that kind, Bernheim said, nope, I can still have hypnosis done onto people that are not like that, who are men. That's supposed to give them any power. And those who are kind enough against this belief, against hypnosis, you can still put them into hypnosis. So that was Bernheim. And Bernheim didn't just stop there. So Bernheim tried to extend the idea of hypnosis to say that there's nothing actually special about a hypnotic procedure. He said suggestion, what he would promote, was something that can take place outside of clinical conditions. It's something that we can be susceptible to all the time. And this is something that is widely accepted today among most people, that as humans, as we go through life, as we go through cultural, and as we meet other people, we're all always kind of susceptible to this kind of subconscious programming. It is a very vague idea, quasi new age idea, that your brain is going to pick up certain things subconsciously as you speak and interact with people, and that's how you can be suggestible to things, and that's how you can be hypnotic kind of procedure. And that's kind of what Bernheim was suggesting to, was that hypnosis isn't this neurally dominated kind of framework that is supposed to happen in this procedure, but it's something that can happen almost all the time. And this was the starting of a big debate in France among the Salpêtre doctors, the Salpêtre school, and the Nancy doctors, following Bernheim. So the Salpêtre doctors were the doctors following Charcot, and Charcot's students like Pierre Janet. And they considered hypnosis to be under this neural dysfunction. And it was something specific to the disorder of hysteria. That's something that Charcot believed until, I believe, his death, that hypnosis was something that was done specifically to the hysterics. You cannot do that to other disorders or other people, which was, of course, disagreed heavily by Bernheim. But a part of the reason why Salpêtre doctors were so vigorously rejecting Bernheim or Bernheim's supporters was for the fact that Bernheim almost kind of blurred the boundaries between what was to be done in the clinic and what was just happening in the rest of the world. Like, what do you do as a clinician to treat using hypnosis, and what was happening through other people's interactions with you? And, well, the question remains, is your hypnotist or the doctor doing anything different than what's happening already in the world? Like, what is scientific about that? Like, why is it that I'm being treated by this method? What are the benefits of that scientifically? So Bernheim was kind of insisting that there is no difference. We'll get to that in a bit. But what Bernheim hinted at is that the scientific grounding of hypnosis is not as strong as we would hope it to be. So Bernheim considered the work of Charcot to be very much misguided. So what Charcot was doing to his hysterics, making them do some stuff, under the hypnotic trance or the hysteric symptoms, Bernheim considered those to be just suggestions from Charcot. And Charcot disagreed with that. Charcot thought, nope, these are neural dysfunctions. This is how the hysteric is supposed to be. But Bernheim was rather suggesting it's just Charcot being blind. Charcot is not like doing anything new or finding anything new in the mind of the hysteric. He's just looking at the mirror, because that's what suggestion is supposed to be. When I'm suggesting something to you, it's supposed to, and you're supposed to enact it. And when you enact it, you're not saying anything about yourself to me. You're just enacting what I said you to do. And that's what Bernheim thought Charcot was doing to his hysterics. And Bernheim was also vigorously against Charcot's works. And that was, again, as I said, a big debate. Later, around 1892, there was an international congress on hypnotism in Paris. And Janet, one of the closest students of Charcot, heavily criticized Bernheim's work to be anti-scientific and anti-psychologic. He thought what Bernheim was doing was basically just randomly, erasing the boundary and randomly saying, okay, everything is suggestible. And this was a very heavy blow to Bernheim. And various schools in France, various schools of neurology in France and psychology were afraid that our entire field could be unscientific if Bernheim stood correct to his claims. And it would not be uncommon today to also ask, how much of what the scientists are doing are kind of from their own biases. So one can immediately see that what can we know about someone's mental world if suggestion is so commonly possible? How can I know that this person's mind is structured in this manner if the process in which I'm interrogating the other person's mind is by suggestion, because I'm just creating what I'm trying to see? And then it's common to ask, who would be the soul so without flaws as to not produce suggestions during the treatment or the investigation, right? Because to imagine that you're actually able to know someone's mental world and like make claims about it, then you would have to be the soul who does not have any flaws, who would not do anything suggestible, right? And Bernheim's answer was that, of course, such a soul does not exist. This is an answer that we've internalized almost entirely today, that one cannot draw a distinct line between when you're suggestible and when you're not, or when it is your suggestion and when it is the actual person's psyche. So no matter what you do, the scientist or the therapist or the hypnotist has a big say in how they influence the subjects. And this is what we've termed these days quite vaguely as bias. So we can say, the scientist has bias in the statistics that he presents, or the scientist has bias from the questions that he asked the patient. And that was something that started from Bernheim's criticisms to Charcot and to psychology in general. So Bernheim thought that through hypnosis, what you can do is you can put your body in a state of recovery. This is also something quite common in today's world among those who promote hypnosis, be that hypnotherapists or new age people. And there's this inherent idea that what you do in hypnosis is you put the person into a state, and what happens is that then you allow the kind of organic healing to happen. So there's no cure that's being done by the hypnotherapist. The hypnotherapist is only helping the person get to that state, right? So your job is to make sure that you can get to that state, and the rest happens on its own, so to say. So this is something that Bernheim writes in his book called Suggestive Therapeutics, where he says diseases are cured when they can be cured by their natural biological evolution. Our ordinary therapeutic methods consist in putting the organism in a condition such that the restitutio ad integrum may take place. We suppress the pain, we modify function, we let the organ rest, we calm the fever, we retard the pulse, we induce sleep, we encourage secretion and excretion, and thus we permit nature, the healer, or to speak in modern language, we permit the activity of the forces and their properties inherent in the biological elements to accomplish their work. So you see, what the hypnotherapist does is he takes you to this state, this kind of rest to the organ. It doesn't have to be the whole body itself. It can be just one part of the body which is kind of in pain. And what we can do is we can suppress the pain, we can give some calmness, we can induce sleep. And what we can do is we can let the organic properties from the biological elements do their work. But so that was kind of Bernheim's natural cure through the natural way, something that we still have, as I said. But Bernheim was not still kind of giving an answer to the problem. What are you going to do with the investigations that Charcot did to his hysterics? Right? The immense amount of case studies that Charcot did and the accuracies of that. Bernheim still didn't have a good answer to that. So that's where I will leave Bernheim, Charcot. I will leave the history surrounding our situation. Bernheim continued with his interventions. He did not agree with Charcot at any point. It was rather Charcot's work that went under the shadow, and Bernheim who came to spotlight through hypnosis. But that's for another day. So where was Freud in all this? So what I will do is I will pull up some early writings of Freud between 1886 to 1889, and I will tell you how Freud was dealing with these kind of debates and these questions of what was supposed to be done with hypnosis. So Freud wrote a report on what he was doing on his studies in Paris and Berlin. If you can check, you will have to check the Standard Edition Volume 1. There's this report where he talks about what he studied in Paris with Charcot. And what Freud writes there is he considers Charcot to be the person who pulled the dilemma of hysteria out of muddy grounds. Not just muddy grounds, but out of grounds which were harmful to hysterics. So Freud writes, the state of illness to which hysteria is applied is only characterized specifically by negative signs, negative symptoms. It has been studied little and unwillingly, and it labors under the odium of some very widespread prejudices. Among these are the supposed dependence of hysterical illness upon genital irritation, the view that no definite symptomatology can be assigned to hysteria simply because any combination of symptoms can occur in it, and finally, the exaggerated importance that has been attributed to simulation in the clinical picture of hysteria. So again, as I said, we will look to hysteria later. But what Freud is saying here is that before Charcot's interventions, hysteria had this very dubious situation, because you had doctors treating a hysteric woman by by various methods of interacting with the genitalia, of considering that it's the genital irritation that causes the illness. You had various ways of considering it as demonic possessions. So, like, hysteria was in the situation of being almost mystical, and or something totally anatomical about the genitalia. And it was Charcot who kind of gave it a very not totally, totally peculiar or precise, but somewhat a better nosological diagnosis or some kind of structure to it. So Freud was also amazed by Charcot's use of hypnotism. So he realized that Charcot's use of hypnotism was less mystical than others'. So he says, I found to my astonishment that, here were occurrences plain before one's eyes, which it was quite impossible to doubt, but which were nevertheless strange enough not to be believed unless they were experienced at first hand. I saw no sign, however, that Charcot showed any special preference for rare and strange material, that he tried to exploit it for mystical purposes. On the contrary, he regarded hypnotism as a field of phenomena which he submitted to scientific description. So this is Freud trying to describe how his experience of Charcot's lectures were not about Charcot pulling up strange and rare things and kind of magically saying, yep, this is how hypnotism works, and this is how things magically kind of magically show the neural side of it. That's what Charcot was trying to say. But Freud kind of realized that Charcot was very humble in his use of hypnosis. He used it as a scientific method. And this was part of how Freud felt about Charcot throughout the rest of his life. He considered Charcot to be the man who lifted hysteria out of all the chaos of the neurosis and differentiated from other conditions with a similar appearance. And so you can see, so you have a Freud admiring Charcot in his early works, in his report. You don't see a lot of Bernheim in Freud's that period of writing. But Freud very soon gets over to the other side. He trains with Bernheim for some time. After 1886, around 1889, he's starting to work with Bernheim. And he's starting to see that things are not how Charcot would have them, right? And much later in 1930, Freud in a letter writes that in the question of hypnosis, it did take sides against Charcot, though not wholly with Bernheim. And this is part of how Freud was kind of positing himself. He was moving away from Charcot. He was certainly against Charcot at one point, but he was not entirely with Bernheim either. And that's where Freud starts to kind of create his own methodology of how to think about hypnosis. But that's one thing to remember, is that Freud was not with Charcot, neither with Bernheim. But before he got to that point where he was, with his own theoretical framework, Freud was struggling between both the sides, because Freud had translated Charcot's works. He had translated the compendium of Charcot's Tuesday lectures, and he had also translated Bernheim's suggestion, the book Suggestion. And thus you can see that Freud was very much on both sides of the debate. He was very well acquainted with with both Charcot and Bernheim. And he says in the preface to Bernheim's suggestion, the preface can be found in, again, volume 1 of Standard Edition, where he says, in my opinion, the shifting and ambiguous use of the word suggestion lends to these antitheses deceptive sharpness, which actually does not exist. It is worthwhile considering what it is which we can legitimately call a suggestion. No doubt, there's some kind of psychical influence which is implied by the term suggestion, but what Freud decided to say is that he said suggestion is a specific kind of psychical influence where the brain accepts the idea without any kind of restriction. So you can have different kind of psychical influences. You can have a command, you can have a denial, you can have other kinds of influences. But the kind of influence that Freud was talking about when he was talking about suggestion was it's something that the other person admits or lets into his mind without any kind of restriction. So that was suggestion. And this is how he kind of takes a different side in comparison to Bernheim. So Bernheim suggested, nope, suggestion can happen almost any time. But Freud was much more specific. Freud was saying, nope, we have to have a specific condition when the idea goes in without any restriction. For that, he was going to use different methodologies. But that's when suggestion is happening. It's not something that happens randomly all the time. So Freud in 1891 wrote an entry to a dictionary, a medical dictionary, and the entry was on hypnosis. And there he cleanly stated how he differed from Bernheim. He said, Bernheim and others have distinguished several degrees of hypnosis, whose enumeration is of little value in practice. What is of decisive importance is only whether the patient has become somnambulistic or not. That is, whether the state of consciousness brought about in the hypnosis is cut off from the ordinary one sufficiently sharply for the memory of what occurred during hypnosis to be after waking. So this is kind of Freud moving away from Bernheim. And here Freud is trying to say that, okay, we can have different degrees of hypnosis, but what Bernheim has told us about these different degrees is actually of little value in practice. What Freud thought is valuable is that whatever hypnosis you're doing can take you to this somnambulism, the state of consciousness where what comes after hypnosis is cut off from the waking life. So it's actually like sleep when we were considering it earlier from Ambrose, which is that when you create this hypnotic state, what you say to the person, what the person does, has to be totally distinct from what she remembers after waking. And this was something that was characteristic of Charcot's patients. Most of Charcot's hysterics did not remember what Charcot made them do during the demonstration or during the hypnotic state. And Bernheim just said, that's just suggestion. Bernheim said, this is just Charcot suggesting things to the patient and the patient is enacting that. But Freud was like, wait a second, maybe that's not that. Maybe it's because Charcot is looking at a specific form of hypnosis, specific type of hypnotic state where the patient does not remember what happens afterwards. And this is something that's going to be very important for Freud in his treatment of hysterics. So we're already at 1891, and by the time of 1891, Freud had interacted with Joseph Breuer, who was going to be his co-author and a colleague in the treatment of hysterics. But during this time, Freud had done his own work on hypnosis long enough to not be confused by either Bernheim or Charcot's work. So, he had his own foundation, so to say, his own anchor. So, by 1891, Freud had conceived of other approaches where hypnosis fell short. And he kind of realized that sometimes you cannot put people into the hypnotic trance. It's that sometimes they just would not go to the hypnotic state. And Freud realized that there are different kind of things you can do to that. And this was partly due to his developing influence coming from Brouwer's work. We're not going to go there because we're going to, again, treat the hysterics later. But Freud and Brouwer specifically was working on a patient named Berta Pappenheim, and she's named as Anna O in the literature. But during his work with Anna O, Brouwer realized that even though hypnosis was good enough, and you can kind of help the patient get over the symptoms for some time at least, what's important is that if you can take the patient to some state of mind and then ask them about certain things, they say about their trauma, they say about things that have happened to them, and that was what Breuer called as the cathartic process. We will look into that when we get there, but during this time, Freud was already being influenced from these things. So he said in the same dictionary entry that if we are not satisfied with the hypnosis attained, we shall look for other procedures when the treatment is repeated. And here are some of the procedures. It says, stroking the patient's face and body with both hands continuously for 5 to 10 minutes, suggestion accompanied by the passage of a weak galvanic current. So, he has this very slight current given by, I think, the hand and the forehead, which creates this sensation of taste, and there the patient is more suggestible to hypnosis. But regardless, he says we can invent similar procedures at our choice if we only keep the aim before us of arousing, by an association of thought, the picture of falling asleep and of fixating attention by means of a persistent sensation. So what Freud is kind of focusing on is that we have to look at whether we can arouse this state of falling asleep. We have to make the patient kind of slowly transition. This is what it means by an association of thought, that she slowly associates one thought to another until the next thought is falling asleep, and that creates this picture. And what it leads to is this state of somnambulism that I was talking about, is that the patient is now fixating their attention on sensation, on a persistent sensation, let's say pain in the leg or some chronic pain. And if you can take the patient to that state, that should be your goal. So here you can see Freud has already stumbled on a very specific approach to hypnosis. Not a lot of people who are using hypnosis, even those who are using animal magnetism, or people like Bernheim. If you read Bernheim's Suggestive Therapeutics, which is a very amazing book filled with examples of hypnosis, you can find a lot of case histories or case vignettes there of Bernheim trying hypnosis in different ways onto patients. But you can see something like this, where the goal is to create a state by this kind of association to focus on a persistent sensation and use suggestion during this state, right? So Freud considered that just telling or explaining things during suggestion doesn't do much. So he started to find different ways of accompanying these explanations or suggestions. So he writes again in the same dictionary entry that the true therapeutic value of hypnosis lies in the suggestions made during it. These suggestions consist in an energetic denial of the ailments of which the patient has complained, or in an assurance that he can do something, or in a command to perform it. So what this means is that if my patient is going through some chronic pain in the back, what my suggestion would be like, your back is feeling better, or your back is slowly, feeling more calmer. So these are the energetic denials that he's talking about. Energetic denials of the ailments, trying to counter the pain through these suggestions. Or you can also say that he can do something about it. Maybe you would say, put your hand on your chest, and that will make your chest pain feel a bit better. Those are the kind of suggestions you could give. But what Freud realized, that instead of just repeating these kind of things, just saying them, what you could do is you can have a much more powerful impact if you can do some intervention yourself along with the suggestion. So what Freud started to do was he started to have interventions like massage, like pressing and kind of stroking the physical ailments, kind of being a chiropractor, almost like a chiropractor. And what Freud was trying to do is he was kind of immersing his suggestions into these ailments by making these interventions. And that's, again, as I said, that's a much more novel way of doing hypnosis than what anyone else was doing. So he says a far more powerful result than that produced by simple assurance or denial is achieved if we link the expected cure to an action or intervention of our own during hypnosis. So when I am again working with that person with chronic back pain, I will be, putting my own hand over the back, slightly gently stroking it, making it feel more calmer, and rubbing it and trying to tell as the person is falling asleep that it's going to feel better, that soon you are feeling better already, and you repeat the suggestions that you are feeling better, that this is going to make you feel better as you do these interventions. So that was Freud in his 1891 paper on hypnosis. It's a very interesting paper. If you read it, it's not as long, just about 6-7 pages, because it was supposed to be a dictionary entry, right? And you would see when we go to the hysterics, this paper on hypnosis 1891 is already predictive of what he was doing with much of his patients in studies on hysteria. So when we look at the patients, the case studies in the studies on hysteria, we will see he's exactly implementing the method that he said here. For example, the Emmy Vaughan is a case in studies on hysteria, and during her treatment, as she had leg pain, Freud was trying to be a chiropractor, give the massage, as he was asking about her early trauma. So this is something that would be fleshed out clinically later, but it's the seed of something much more closer to psychoanalysis than Bernheim's hypnosis, let's say. So regardless of how important I said if hypnosis was to Freud, Freud was studying it from Charcot, from Bernheim, from others, partly because hypnosis was a big deal during that time. But soon enough, Freud was kind of over the hypnotic technique. And you would realize by the time Freud was setting the foundations for psychoanalysis, he had already moved away from hypnosis. So when we get to the foundations around 1900 or after 1895, much of what Freud is doing is not hypnosis. He is not trying to get the patient into some state or the hypnotic trance. He's rather just doing what we now know to be psychoanalysis, which is cure through speech or cure through talking. So why Freud moved is hard to explain without already understanding some concepts like repression, what is the unconscious. But as I promised, we will have a glimpse of why he got away from hypnosis when we look at the hysterics and the other case studies. So one thing that you should have in your mind as we go through the course is what happened to hypnosis. It's one of the questions that you can have, which will help you later in kind of answering and figuring out why hypnosis is almost incompatible with psychoanalysis. So Freud, nonetheless, actually always tried to show his humbleness. He always said he was indebted to Charcot and to hypnosis. He said that's how he stumbled on what he did stumble on. And but at the same time, he's saying his disagreements. So it's not just Freud saying hypnosis is ridiculous, useless, and psychoanalysis is better. It's more like hypnosis tries to do something else than psychoanalysis. So Freud, what he later said in his papers on technique, that hypnosis became more of a symptom reliever than actually doing the psychoanalytic cure. He realized that it was a way of putting the patient into a state where they don't suffer the symptoms or the consequences, but it could not provide a long-term influence because that became very difficult. It's like, what happens after you've done hypnosis enough times to this patient and they still have the symptoms after getting off hypnosis? And this is something that Freud struggled on his own because Freud, about a quarter of his patients that he saw, he was not able to put them into hypnosis or the hypnotic trance. And that was quite a problematic situation for Freud, but it's like, what else can I do? If hypnosis is the only, so to say, thing in my toolbox that I can use to treat patients, what do I do when it doesn't work? So that's another one of the complaints that Freud mentioned, which was that hypnosis just did not work for him, unlike someone like Charcot, for whom it worked nicely. So that was hypnosis. That was the history of hypnosis. We saw, from Charcot, what Bernheim was doing, where Charcot was going wrong, what Bernheim was suggesting, where Bernheim was going wrong, what Freud was suggesting. So you could see this was a kind of rich period in the history of neurology, where a lot of perspectives were coming in and they were developing in a much more rich manner, very novel views coming in. So that was hypnosis. The next part of the last part of the lecture that we will see today is aphasia. So we saw what Freud was doing from 1886 after he came back from Charcot, from France. He was translating Bernheim and Charcot. He was trying to also look at some German periodicals, some German medical journals, and trying to see where the Germans were at in the discoveries. It was also a kind of very romantically um, high time for Freud. 1886 was when Freud got engaged with Martha Bernays. Not something that I will talk a lot here, but something that's going to be mentioned in the notes. You see them. But yeah, Freud got married or engaged in 1886, and he was looking for some sort of breakthrough to happen in his methodology until that'll come later. But during this time after 1886, working with the hysterics, working with the hypnosis and other methods, Freud was trying to also work on some areas of neuroscience or neurology. So Freud in 1891 was a professor of neuropathology in University of Vienna, and there during his tenure there or his time there, he was also writing this book called On Aphasia. He was looking at the classical literature that has been on aphasia until now, and he was trying to do a critical study of it and see where we can go with it, and also give his own contributions. So, On Aphasia was officially Freud's first book that was published in 1891. And during its time, it was actually quite a significant contribution on the subject of aphasia. But unfortunately, it was barely recognized afterwards. Like after early 20th century, 1905 onwards, nobody, I think, ever took the time to refer to On Aphasia, the book. And even today, very few people know that such a book exists from Freud, even the most orthodox of Freudians. And this is partly because as I said in the beginning of today's lecture, that most of Freud's neurological, neuroscientific works went unrecognized because people thought it has nothing to do with psychoanalysis. And maybe it doesn't, maybe it does, but On Aphasia certainly has much to do with psychoanalysis. So for those who don't know, very simply, aphasia is a neurological illness which leads to impediments in comprehending or being able to formulate language, both verbally and visually. If you would want to, you can put this on the spectrum, the autism spectrum, but I wouldn't know how contemporaries would consider that. But that's aphasia. It's something that gets in the way of you trying to comprehend and use language. So in this monograph, Freud is trying to show his dissatisfaction with the widely praised anatomical approach towards aphasia. So what Freud was thinking was that aphasia was actually a psychological concept, something that was happening psychologically, but somehow the widely considered approach was that of anatomy, and that was due to Meinert, Wernicke, Lichtheim, and others. But much of what Freud was kind of frustrated with was that how can we take the psychological concept and ignore the psychology and just be concerned with the biology? Why are we doing that? And this was actually a very serious criticism that Freud did, and it marked something about the whole field of neurology of that time, which was that of psychophysicalism, because there was this fallaciousness in neurology, where what they were trying to do is reduce almost all of psychological phenomena to neurology, the physical explanations. The the easiest answer to the mind-body problem in philosophy. But that's what was happening. And Freud was much kind of frustrated with that. So some of the people that he was responding to were physicalists, psychophysicalists, Meinert, Wernicke, Lichtenstein, except Jackson, whom we will see a bit. So in the first early pages of the book, Freud summarizes what's actually the situation. The situation is that all authors since Wernicke have explicitly or implicitly adopted the view that speech disorders, if they have an anatomical basis, are all caused by lesions of the speech centers or disruption of the speech association tracts. So, everyone from Wernicke on were considering speech disorders to be caused by lesions of these speech centers, the centers of the brain which were responsible for speech or a speech act. So that's what Freud saw the situation to be like. We're not going to go into the neurology. If you would want to, you can go again to the book on aphasia. It's not as long. It's about less than 100 pages long. But what we will look at is that here in 1891, this is Freud's earliest conceptualization of how language works and what is the relationship of psychological phenomena to physical phenomena. This is Freud trying to wrap his head about how can we think about language? What are words? And how is it that aphasia can tell us something about this relationship? Okay. So Freud heavily disagreed that there are different speech centers in the brain that deal with these different pathways of speech. Something that Wernicke coined as localization. So Wernicke, very simply speaking, said that if we have kind of different pathways of speech, then there has to be different localizations in the brain where things were happening, things were going wrong. But Freud was totally against this. So Freud said, we cannot have perception without immediately associating with it. However, sharply we may separate the two concepts in reality that belong to one single process. So, for example, if you have a perception, you cannot help but have another thought associated to that perception, right? And however sharply you would want to distinguish and separate these two concepts, in reality they actually belong to one single process, which starting from one point spreads over the whole cortex. So the localization of the physiological correlates for perception and association is therefore identical. And as localization of a perception means nothing else but localization of its correlate, we cannot possibly have a separate cortical localization for each. So what he's saying is that if you try to look for the physiological correlates for perception, it's like you have thoughts, you have perceptions and associations of those thoughts, of those perceptions. And if you look at the physiological correlates, like where in the brain, like those white fibers, where are they happening? So if you try to do that, so the localization of the physiological correlates has to be identical. So the perception and association have to be identical. So localization of perception, but does not mean anything, but just that we're trying to look for the physical correlate, physiological correlate of an association. But the problem is we can't have separate cortical localization for each association, right? So you have one perception, you have several associations related to that. Do you really think we can make different cortical localizations for each of those associations? We can't. So the conclusion that Freud came to is that both arise from the same place and are not static. It's a dynamic process. It's something that's happening in different parts of the brain, that uh, we're kind of seeing happen, but we can't think that they're separately happening, that they're somehow communicating to each other as a dynamic. So he makes this critique that they're actually happening in the same place, and he continues with his critique where he says that with this refutation of a separate localization for ideation and association of ideas, we have disposed of an important reason for differentiating between centers and pathways of speech. In every part of the cortex serving speech, we have to assume similar functional processes, and we have no need to call on white fiber tracks for the association of ideas within the cortex. So what he's saying is that once we refute that there are no separate localizations for ideation and association of ideas, we also dispose that there is no good reason to imagine there's different centers for different pathways of speech, something that Wernicke had assumed, because he assumed that there's lesions of speech centers, right? So that's something that Freud also refuted. Here Freud was actually following along with Huxley's Jackson, who had warned that in our studies of the disease of the nervous system, we must be careful, or we must be on guard against the fallacy that what are physical states in lower centers find a way into psychical states in higher centers. For example, vibrations of sensory nerves becomes sensations, or that somehow or another idea produces a movement. And that's kind of the dynamic that Freud was referring to, is that we do not have to kind of separate each part of the brain for each association. We can have them work dynamically. So that's so to say the early part of our first half of onaphasia. If we ignore all the neurological stuff, this is the kind of lesson you're getting from it, is that Freud getting away from the localization of Wernicke. But the most important part of onaphasia actually starts when you look at one of the later chapters, chapter 6 of the book, when Freud dives into the intricacies of what it is that makes up a word. And Freud writes this in page 73 of On Aphasia, where he says, from the psychological point of view, the word is the functional unit of speech. It is a complex concept constituted of auditory, visual, and kinesthetic elements. And that was a very novel approach to language and words in general. It was quite marvelous that Freud stumbled upon this from his study of aphasia. If you look at those 3 pages, falling from page 73 to page 76, he describes 6 kinds of processes neurologically to how this happens, how the word has auditory, visual, and kinesthetic elements. But to make it much more clearer, I will just have this last part, after which we will end, a picture of how this whole thing works. yeah, for some reason the picture is not rendering. So what I will do is I will post the picture on the chat just so that you can have it. Okay, so if you look at this picture, which I've posted in the chat, you will see that here is a nice way of conceptualizing what Freud means by a word. And this is one of the most kind of very beautiful interventions that I have seen from Freud's early works. So you see there's a word and it has two parts. On the right hand side, on the top, you have the visual, and on the bottom or the left you have the sound image, right? So the visual is, so to say, the object associations. So these are the associations that you make from a word about how it looks like. So let's say when I say the word bottle, you can associate plastic, some form of plasticity or something related to the object of the bottle. And these are the object associations that Freud was talking about. And then you have the sound image associations. For example, when I say the word sun, S-O-N, it can also sound, it sounds exactly like S-U-N. So when I say the word sun, S-O-N, you also have some sort of auditory part which is related to heat or temperature and stuff like that. So what this means is, if you look at the little note which is below the image, where he says the word concept appears as a closed complex of images, the object concept as an open one. The word concept is linked to the concept of the object via the sound image only. So this is what it looks like, what the word feels like when I tell you when you tell you that verbally. Again, the sun, S-U-N, and S-O-N. That's the sound image. Among the object associations, the visual ones play a part similar to that played by the sound image among the word associations, right? So again, when you have sound image, I tell you a word and you associate it with different words which sound similar, right? So again, S-U-N, sun, S-O-N, sun, phone, P-H-O-N-E, and fun, F-U-N. So these are the sort of word associations you can make from the sound. And the object associations are similar. The object associations leads to physical aspects of the object. So when I say, let's say, I don't know, green table, green grass can be associated with it, and other things that are green can also be associated with it. So these are the object associations. So when Freud says there's closed concept of closed complex of images, what he means is that if I give you a visual input of an object, there's so many things you can associate with the object, right? So compared to what you can do verbally, how many things you can associate from the sound of a word, there's infinitely many things that you can associate from the visual aspect of a word, right? So you can see when you look at the top part of the diagram, those are actually not flowcharts, but arrows that are not ending. These lines, they do not have another circles because they continue. They will continue to have more associations. Object associations are always creating more associations. But if you look at the lower part of the diagram, the word associations are actually more or less limited. You can only have from sound image, visual image, or the kinesthetic image from there. And this is Freud basically predicting what he's later going to say as word representations and thing representations. So when we get to Freud's metapsychology, the unconscious paper in 1915, when he tells us what is a word presentation, what is a thing presentation, this is what Freud is kind of working from. So it is very interesting to think that Freud in 1891 was already giving the seeds to what he would do decades later. And that was 1891 on aphasia, which marks, so to say, the last neuroscientific work that Freud did, more or less, after which there's no major publication. And after 1891, much of what Freud was trying to do was with the hysterics, which we will see in our next session. So thank you very much for staying until now.